The Ontario government is bringing in new rules for supervised drug consumption sites, which will ban them from operating near schools and childcare centres. The province says the ban will make communities safer. It also says it will expand treatment and recovery services for addiction. But advocates say the site closures will lead to more drug overdose deaths. For more on this, we've reached Juanita Lawson. She is the CEO of Norwest Community Health Centres, which operates Path 525, which is Thunder Bay's only safe consumption site and is among those being ordered to close. She is in Thunder Bay, Ontario. Thank you so much for making time for us today, Juanita.
Thank you for having me.
So this site in Thunder Bay, it's located within this 200-meter rule of it can't be near schools or daycares, so it's going to be shut down. Can you tell us about the users, the people that this site serves now?
Yeah, I think, and you're correct, Path 525, which is a program of Norwest Community Health Centres, has been operating since 2018. And since this time, our staff have done a lot of work to really engage with our community. And part of that is engaging with part of our community that otherwise would not access services. And so the clients who use our services are generally people who have had difficulty accessing care, do not trust the system because of difficulties or, difficulties with experiences. And so those individuals are often more vulnerable, at risk. Many individuals do not have housing, may have not sought services for mental health, but also generally are food insecure and really struggling with some of the basic needs that many of us are privileged to have ourselves.
So what services do they rely on that center for the most, Juanita?
Yeah, so the consumption and treatment services is a place where individuals can bring their own substance and then under the supervision of a registered nurse and with support from a harm reduction, outreach workers and our system navigator can actually use that substance, and in case of an overdose, they would be supported by a registered nurse and by the team to ensure that they're safe at that time. And one of the things that we know with consumption and treatment services and with a service such as this is it really reduces the demand for emergency medical services, paramedics, and for individuals to be not accessing services through the emergency department should they experience an overdose.
Juanita, I want to take a look at a bit of data that we have here. We've got a chart that shows that Thunder Bay leads Ontario subdivisions with the highest opioid-related mortality rates. This is data from 2022. We heard the Health Minister, Sylvia Jones, saying today that the cycle of addiction is not being broken by using these safe injection sites. I wonder what your experience has been like on the ground with trying to break that cycle and with the, just the state, the level of opioid concern within the community.
I can appreciate the need and the desire to access more, to provide access to detox services, to treatment beds. We really applaud that. I mean, we do know that when individuals are using our services and want to go into treatment, the delays and the wait time cause significant issues, whether people are using substances such as alcohol or drugs. So we do appreciate that need to do that. I think it definitely comes. We've learned from many of our staff who we've hired a significant number of individuals with lived experience who work in many of our mental health and substance use programs who have come through their own journey of recovery. They have done some significant work to work in our organization to develop relationships with individuals to get them into our programs so that we have opportunities to develop those relationships, but also provide services that they need at that time and other options for care that they might not otherwise have considered or been made available to them. So I think through that learning, we do know that there is, we do offer a safe supply program as well, which is federally funded. And we have some significant data that shows us that many of our individuals who are provided with those services with a trusting relationship, many of our clients who were in these programs have gone on to treatment. And so that's our concern is, in terms of shutting services across the province, that people in Northern Ontario will not have access, period. And so while we have opportunities to develop a health hub, while we have opportunities to, create a different type of service for individuals who are using substances, without any supervision, without any support, without anyone there to administer naloxone, we are gravely concerned that the demand on emergency medical services, the demand on our emergency departments, but more importantly, the loss of life will happen. And we've lost a lot of people in our community already. And those are not just individuals using our Path 525, but these are individuals who are using substances alone in their own home.
Juanita, do you plan to apply to transition to be one of these recovery centres that the province is going to be funding instead? I mean, I know this is all new, so perhaps you haven't made a decision yet, but do you think you might?
I mean, I think, yes, as an organization, we have a responsibility to look at what services we can provide. We are, very well aware that the toxic drug supply is not going away. We're well aware that people continue to need services. We do know that not having access to, a consumption and treatment service where people can come is a real concern for us. However, we will be looking at the application process. But I mean, I'll say honestly, it's a blow to our communities, and it's transitioning this service in a way that might not meet people's needs immediately is going to be challenging.
Juanita, really important to get your perspective on this situation, of course, impacting you and the community of Thunder Bay directly. Thank you so much for your time.
Yes, thank you very much for contacting us. Appreciate it.
Juanita Lawson is the CEO of Norwest Community Health Centres, which operates Thunder Bay's only safe consumption site.